Hello, so my name is Mohammed Amin Shadi. I am a PhD student at the University of Qadi Iyad, Marrakesh, Morocco. And today I will present our work entitled Reinforcement Learning Based Decision Support Tool for Epidemic Control by me and Professor Hajar Musannif. Yeah. So context. So COVID-19 is certainly one of the worst pandemics ever. The absence of vaccine, classical epidemiological measures such as testing in order to isolate, quarantine, and social distancing are ways to reduce the growing speed of new infections as much as possible and as soon as possible, but with a cost to economic and social disruption. It is therefore a challenge to implement timely and appropriate public health interventions. So the main question of this paper is, can we use AI-based approach to learn how much intensity of each public health intervention should be applied at each period in a given region? So methods. And the approach exploited is known as reinforcement learning. And reinforcement learning is a subclass of artificial intelligence that primarily deals with optimal sequential decision making in a particular environment. Here's an example of reinforcement learning. So here we have an AI-driven agent, just an AI algorithm, and this algorithm is generating actions. Um, These actions will impact the environment, which is here in this example is just the game, the famous Atari game. And then the environment will present us in the next frame, in next state, will present us with new images, new frames, because it's just going to be modified here. And then the reward is just the score that the agent is trying to maximize. This is the process in a nutshell. And this approach seems logical when we analyze the actual real process of epidemic control. In a real process, in reality, we have public health authorities, like the government, which is generating and applying actions like travel restriction and quarantine and remote work and study, etc. And these actions will impact the evolution of the epidemic. And the epidemic will show up in the next measurement, like next day or next week, will show up with new infection rate and new mortality rate, etc. And the feedback can be measured like if we are in a desirable situation for health and economy, then we have a positive reward. We have, and then we have a negative reward if we are in an undesirable situation for health and economy. Yeah, so and it's the same illustration here. We just replace the public health authorities with an AI agent and the real epidemic with a mathematical representation of the epidemic, which is an epidemic model. And here is the epidemic model, the epidemiological model or the environment that we implemented. So here in first stage, we have every region has a normal population, and the normal population will be contacted by a current infected people. This interaction will result in new infectious people, and this new infected people will be governed by the transmission rate. Here, S1 or state 1 is just the transmission rate. And the next infected people will be divided into two categories, unknown carriers and known carriers, U and K. Here you can see the legend. And this division will be also governed by the S2, and S2 is just the identification rate. Like if the agent can identify certain people, then the more it can identify, the more we have known people. And the agent should learn that identifying real people, identifying known carriers is proportional to like the testing rate, for example. And then in the end, we have the known carriers will be divided into recovered people and deaf people. And this division will also be governed by S3, like stage 3. And stage 3 is just the death rate. And this is proportional to like for example, how much we have aged people or how much we have um, chronic disease people, the people with chronic disease. So still in methods, here we will discuss the agent, how we constructed the agent that is performing here, and how we are monitoring the performance of the agent. So in reinforcement learning, there is a known class of algorithms like Q-learning, DQ learning, and PPL, you know, like a whole lot of algorithms. And here we choose to use a pretty basic, relatively basic, can we say, algorithm known as reinforce. And here in reinforce, we choose an arbitrary theta. Theta is just the weights of the neural network, because here we are using like artificial intelligence and deep learning is used here. And theta is just the weights of the neural network. And for each episode of this interaction of the agent with the environment, we will track the states, the action, and the reward. State, action, reward, state, action, and reward. Yeah. And then we will update the theta, which is the weights of the neural network, using gradient ascent. Not gradient descent, but gradient ascent. Because here we're trying to maximize this utility function. And this utility function is just saying that how is the log likelihood. We want to maximize the probability of picking certain actions in a given certain states when VT is positive, and VT is just the proportional to the reward. It's the value function, and the value function can be thought of as the reward. Yeah, and we will do this iteratively for here we did it for 20,000 iteration, and you can see that in the 5,000 iteration, the agent has gotten into a good place, and it has been stabilized into 70% of success. Yeah. And you can see here, if in the result, here we simulate the performance of a non-trained agent, or at the beginning of the training, like here, we track the agent here in this beginning of the agent of the training, and here you can see that the infected population is pretty high, like it is in the amount of hundreds. Yeah, and if we simulate the performance of a well-trained agent, or at the end of the training, here we can see the agent is the infected population is just in the amount of it is going to be 0 in most cases, and some rarely cases will go to 30 or 20. Well, it's a good performance. Yeah. So just to conclude here, this is just a preliminary work, and we can say in the conclusion that the reinforcement learning agent was simple model that we used. It's just a multi-output regressor with MLPs as estimator, and we used in the training fashion was just the reinforce algorithm, which is, as I said, is a relatively simple algorithm, which means that better learning performance can still be achieved if using other complex models. And the other idea is just that the agent was able to satisfy a trade-off condition that balances between a predefined health score and economy score. And therefore, RL, or reinforcement learning, provides a promising tool for making state-dependent optimal strategies, and also easily interpretable by decision makers. Finally, future research will focus on scaling the same approach and adding other features to it. So thank you for your attention.